I just couldn't believe that I had gone in for a biopsy and it had turned into this.
I was angry. I don't think they realized how serious it was.
It looked like my flesh was being eaten away from the inside out.
She stopped moving. She stopped breathing.
I thought she was just gonna die.
Next, two medical mysteries that defied the experts. When June Pecce goes in for a routine breast exam, little does she realize that in less than 72 hours, she'll be in a desperate fight for her life.
I woke up and was missing 3/4 of my left breast. I could feel my body dying.
Then, 10-week-old Brianna Headings seems like a healthy baby in every way, until her parents experience what can only be described as the shock of their lives.
Her eyes started to bounce in the back of her head, and she was hard as a rock. I knew something was not right.
In Iraq, I've been shot at. It doesn't even come close to as scared as I was.
In the fall of 1999, 36-year-old June Hook had just started working at a local printing plant in Portsmouth, New Hampshire, when she met a man who captured her heart, Kirk Pecce.
I was running a printing press, and she was a customer service rep at the company we both worked for. She had a great personality. I loved her smile, and I just thought she was beautiful.
He'd flirt with me every morning when I was going into work. And then he just started bringing me in coffee, and the relationship blossomed from there.
I was comfortable with her. She was comfortable with me. It felt like we've known each other a lot longer than we actually had.
He was funny. He made me laugh. And we liked doing the same things.
And within 2 years, June and Kirk were exchanging wedding vows before a small group of family and friends.
It was in our yard at our house, and we just had a huge party afterwards.
Over the years, the couple shared an unbreakable bond.
We just loved spending time together.
We had a good time. Kayaking, fishing, all different kinds of outdoor stuff.
June's active lifestyle keeps her fit and healthy. So in April of 2009, when she goes in for her annual mammogram, she fully expects to receive a clean bill of health.
I really haven't ever had any problems in the past, so I just figured it was going to be a routine visit.
But the results are anything but routine.
A mammogram found 2 small masses on my left breast. There was a small anxiety that there could be some cancer.
I was scared and nervous. I've seen several people in my life, die of cancer.
The doctors decided that they wanted me to go in for a stereotactic biopsy, where they go in with a needle and extract the specimens, and they leave behind a small titanium chip so that during future mammograms, they'll be able to tell where specimens were taken from previously. They sent out the tissue for testing and told me that I should hear back from them within days. My biopsy results came back negative.
I was very happy to hear that.
But her relief is short-lived. When June wakes up Monday morning, she's alarmed to see a disturbing change in her breast.
I noticed that there was a painful portion of my left breast, and there was a small lump. It was red and hard to the touch. It was extremely painful. I had a hard time reaching up to the top of the cabinets in the kitchen, and it almost had a tingling sensation like any infection normally has. Lifting things was very painful. Simple things like carrying laundry hurt. It was very frustrating. My husband suggested that I get in to see the doctor. The doctor looked at it and said it was warm to the touch and took specimens from that so she could send out cultures on it. She gave me a prescription for pain medication, and an antibiotic.
Despite the week-long course of treatment, the redness and inflammation seem to spread. And even more troubling, pus begins oozing out from June's breast.
It looked like an infection that needed to be cleaned out.
At that point, the mark was probably a half an inch to an inch across.
Horrified, June schedules an emergency appointment that afternoon.
The breast specialist thought that the infection may have been caused by the titanium chip that they had put in my breast. The doctor took me in for surgery and cut out the titanium chip.
The procedure goes smoothly, and June breathes a sigh of relief.
It seemed reasonable that the titanium chip would have caused the infection.
I thought that was going to be the cure-all to what was going wrong with June.
But nothing could have prepared her for what she sees while she's changing her bandage that night.
It looked like my flesh was being eaten away from the inside out.
It looked awful to me, just horrible. It was a 3-inch gash in her chest. It looked like the flesh was dissolving, and there was pus all around the edges. It was just very, very wrong.
That night was very difficult for me. I had a hard time sleeping that night. I had an open wound on my chest. The pain medication that they gave me really wasn't doing anything. It was extremely painful. The wound had gotten a lot worse just in that 24-hour period. I went back to see the doctor, and she immediately had me admitted to the hospital. They took more blood, they took more cultures from the wound, and informed me that they couldn't figure out what was wrong.
Over the next 5 days, June watches in horror as her painful wound spreads out of control.
The pain was horrific. It didn't feel like anything else I had ever experienced, especially when they'd come in to change the bandages. It felt like they were ripping my flesh off.
I was angry. I don't think they realized how serious it was.
I just remember them talking and arguing with each other, but no one really having an answer. I honestly thought they had no clue. It was like being trapped in a nightmare.
After undergoing a biopsy, June Pecce has developed a mysterious festering wound that's ravaging her breast. It seems to be immune to antibiotics, and even more baffling to her doctors, not a single test has turned up anything even remotely out of the ordinary.
It was very difficult. I was stressed every day. I didn't know what was going on. My worst fear was that she was going to die.
I honestly believe if I hadn't asked them to be transferred, that they would have let me sit there until I died.
She said, I'd like to go somewhere that can save me, or at least help me.
And at that point, I requested to be transferred down to Brigham and Women's in Boston.
45 minutes later, on-call trauma surgeon Dr. Amy Rizak takes over June's case and is stunned by what she sees.
Her left breast was all dead skin. On the upper, inner, and outer quadrants, it had bluish and black discoloration, and in addition to that, there was some gray drainage from the small opening in her left breast. I was concerned for necrotizing fasciitis, also known as the flesh-eating bacteria.
Necrotizing fasciitis, or flesh-eating disease, is an extremely rare antibiotic-resistant infection that destroys skin, fat, and tissue. It spreads rapidly, and if not stopped, can be deadly.
It was very scary to hear those words. June went in for a simple breast biopsy, and she came out with possibly a flesh-eating bacteria.
Alarmed by the severity of June's condition, Dr. Rizak schedules emergency surgery at 2 a.m.
It was extremely important to act quickly and take her to the operating room.
I was scared that she was going into surgery, but I was happy they knew what was going on.
By removing the dead tissue, we would stop the infection from spreading and to allow any viable tissue to remain viable and not become infected. If we did not do anything urgently, the disease would have progressed rapidly and the patient would have died.
It seemed like seconds were hours. It was horrible just to sit in the waiting room, just to wait for her to come out of surgery to make sure she was okay.
The entire upper portion of June's breast was removed. It was all necrotic tissue.
Groggy from painkillers, June doesn't know just how much of her breast she's lost.
It's a total blur. I was in and out of consciousness. When I was conscious, the things that I remember are when I was having the bandage changes. Where they had done the surgery was excruciatingly painful, even on morphine.
The next 12 hours are critical. If the operation has been successful, June's skin should begin to heal.
At that point, I felt that we were able to get most of the infection out of June's breast and give her immune system a little bit of a chance to catch up.
But soon after the surgery, as Dr. Rizak is checking on June, she's completely taken aback by a frightening new development.
I was shocked to see how much the redness and the necrosis had spread along her chest wall and down to the lower portion of her left breast.
Clearly, the surgery hasn't stopped the terrifying disease. And within the hour, there's another unmistakable sign that the infection is once again out of control.
Her white blood cell count was going up, and she was having high fevers almost continuously.
White blood cells are essential players in the body's immune system. When infection or trauma occurs, the body sends these cells to the affected area to help heal and repair the tissue. But in large numbers, they can cause dangerous inflammation.
The body's inflammatory system just goes into overdrive. Blood pressure gets low, and the patient basically just spirals from there.
I, at that point, really thought I was dying. I could feel my body just shutting down. Everything was just shutting down.
I spoke to the family again and told them that the infection was spreading and she needed another operation.
June is rushed back into surgery, her third operation in 2 weeks.
About 10 centimeters by 4 to 5 centimeters of tissue was removed from the lower portion of the left breast.
Obviously, it was a necessity, and it's something that can be fixed down the road. My biggest thing was I just wanted her to be healthy and come home whether she had 1 boob or 3 boobs.
Just a few hours after surgery, Dr. Rizak spots something so startling, she begins to reconsider her original diagnosis.
I noticed the necrosis on the IV site on the right arm. It was rare to see 2 separate sites of infection on 2 different sides of the body. That was the moment I realized that this was something else.
With June going downhill by the hour, Dr. Rizak immediately calls in Dr. Clarissa Yang, a dermatologist at the hospital.
I was surprised at how large the ulcer was. She had basically lost all of the upper layers of the skin. I was worried that it wasn't an infection, which was what was presumed in her case. Based on what I saw, we suspected that she had another very rare skin condition.
But the only way to confirm her hunch is to administer a heavy dose of steroids. And if they bring down the acute inflammation, Dr. Yang will know exactly what she's dealing with. But the treatment is a gamble.
If this was actually a rare infection, giving steroids to June would have worsened her infection, and she could potentially continue to deteriorate and potentially succumb to her disease.
Risky as the treatment is, all Kirk can do is take the chance and pray that the steroids will work.
I'm sitting in the hospital and she's fighting for her life. I cried and cried and cried, and it was just killing me. Not knowing if I was even going to have a wife to go down and see the next day.
For the last 2 weeks, a mysterious, horrific disease has been literally consuming June Pecce's breast. Now, she's been put on a heavy dose of steroids, a dangerous last-ditch effort that could stop the disease before it kills her.
I went in and saw her, and I just broke down crying. She had the breathing tube down her throat. She just was sedated right out of it. And at that point, I was the most scared I've ever been in my life.
But only 8 hours after starting the treatment, June begins to slowly show definite signs of improvement.
The borders of her ulcers were getting better. There was no purplish hue. Her fever, her white blood count, they all were trending in the right direction.
It was the first thing in 3 weeks that had made a big impact. I was ecstatic that what they were doing was helping.
I didn't feel like my body was dying anymore.
The fact that she was getting better on steroids confirmed her diagnosis. June was diagnosed with Pyoderma gangrenosum.
Pyoderma gangrenosum is a rare immune disorder that destroys skin and tissue. In a healthy individual, when the body suffers a trauma, white blood cells are dispatched to heal the damaged area. But in patients with Pyoderma gangrenosum, too many white blood cells are unleashed, flooding the injured site and ravaging healthy tissue.
We don't understand why patients with Pyoderma gangrenosum have this overactive immune response. There is so much of an immune response that comes into the wound bed, it overwhelms the wound bed and actually causes the tissue to die off instead of heal itself. We're not exactly sure of the exact mechanism of why that tissue dies off. That might be too many cells. We have no idea.
When I finally got the diagnosis, I was so relieved that finally someone had figured out what it was and given me some answers.
While she can't know for sure why the disease set in when it did, Dr. Yang suspects the disease was triggered by the very first invasive procedure June had 4 weeks ago.
June went in for a breast biopsy and she developed redness and an abscess formation. Because she has Pyoderma gangrenosum, her white blood cells have come to the area and overwhelmed the area to cause tissue death. Trauma of her skin seems to act as a magnet to these white blood cells.
And the procedure to remove the titanium chip from her breast was the next step in the vicious cycle of surgery that perpetuated the condition.
Anytime you traumatize the skin, the disease process gets much worse.
I think that we're causing more damage than good because every time the tissue was cut away, that was trauma to the skin.
I don't think it really sank in until I saw the wound open for myself to realize how far this had spread. It was hard. It was hard.
I just couldn't believe that I had gone in for a breast biopsy and it had turned into this. It was scary.
If there was never a surgery done on the wound, it may have just been an abscess that would have healed or became an ulcer that was still small and relatively manageable.
While June is overwhelmed by the horrific turn of events, she's fortunate to have received her diagnosis when she did.
If the patient is not properly diagnosed, they can die from the disease because they continue to get repeated surgeries, their wound gets larger, and blood pressure falls. Her organs could have completely failed on her.
The harsh truth is undeniable. But more than anything, June now just wants to know how to stop the disease that has been wreaking havoc on her body.
I went into the hospital and I had a little hole in my chest, and I woke up 3.5 weeks later and was missing 3/4 of my left breast. At that point, I just wanted someone to tell me that they could fix it.
After enduring 3 unnecessary surgeries in which doctors removed most of her left breast, June Pecce is finally on the road to recovery. The steroid treatment Dr. Clarissa Yang began administering 8 hours ago is working so well, she's going to continue the therapy to treat the rare skin disorder June is suffering from, Pyoderma gangrenosum.
Once you initiate steroids, you're decreasing the total number of immune cells to a more reasonable level, and then those cells are now able to help the wound heal. She responded extremely quickly, and her wound started closing.
Amazingly, after just 3 weeks of treatment, June is well enough to go home. But emotionally, she's finding it hard to come to terms with how much of her breast she's lost.
It doesn't look like me. It's terrible.
She was definitely depressed about what had happened.
While reconstructive surgery is an option, there's a downside. Even if June is on medication, the invasive procedure could trigger her disease again.
We don't know whether her pyoderma gangrenosum would recur or whether she would heal normally. And she has to live with the fear that this may also happen to her again in the future if she had any type of trauma or injury. She can get a paper cut and she could develop an ulcer.
As grateful as she is to have survived the gruesome ordeal, June can't help but wonder why it took so long to get a solid diagnosis.
The prevalence of pyoderma gangrenosum is not well known, but it's thought to be around 1 in 100 to 300,000.
Thank God. I ended up going to the one hospital with the one surgeon who knew someone that knew about this disease.
I had never seen Pyoderma gangrenosum before. Her specific case was unusual because she presented in an atypical manner.
Fever is rare in pyoderma gangrenosum patients. The white blood cell count elevation in the blood itself is also rare. Pyoderma gangrenosum is typically thought of as a disease that occurs on the lower extremities. So her case being on the chest was unusual.
Today, June is living a full and happy life. While she's still healing, her mind is on the future.
As far as my health goes, I feel good.
I'm ecstatic that I have my wife back. I said we'll get through it, and we'll deal with it after. As long as you're home, I'm very happy.
Every day is special. My husband and I spend as much time together as we can.
Today, she is definitely at terms with what happened and knows that down the road, yes, eventually we'll be back to normal.
Are you a good boy, Ryan? I've never really questioned anything that's happened to me. I always think that something happens to us for a reason. And maybe this happened to me because I was strong enough to get through it. And I can let other people know about it.
While June Pecce had been seemingly healthy her entire life, Brianna Headings' life was at risk within just days of her birth. In the fall of 2005, 22-year-old Katie Rogers was working as a waitress in Wichita, Kansas, when she met her husband-to-be. 20-year-old David Headings, a Marine sergeant on leave from his first tour in Iraq, walked into Katie's restaurant, and her life was changed forever.
I saw him and told the hostess to sit him in my section, and was flirting with him.
We only had 2 weeks before I had to go back, so we spent every extra moment we had together.
I knew the first moment I met him, there's something about him that was different.
It just really clicked. Like, yeah, I love this woman.
Just 3 months later, they got married at the local courthouse.
Everyone was not wanting us to do it because it was really quick, but we were ready to get married. We loved each other. After we got married, he went back and forth from Iraq, so I was by myself a lot. It was very difficult.
Finally, almost 2 years after they first met, David completes his tour of duty. Soon after he returns home, the couple receives some thrilling news.
I found out I was pregnant December 7th of 2007.
I was really excited that she was pregnant, and I was also really nervous about being a first-time parent.
As they begin preparing for the baby, Katie and David settle down in Wichita. She soon finds work at a local hair salon, and he lands a job in the aircraft industry.
My grandpa let us rent one of his houses that we had and got it all fixed back up when we moved in.
9 months later, on August 12, 2008, the proud young parents welcomed their daughter, Brianna Paige Headings, into the world.
She looked just like me. It was just the most wonderful experience that I have ever had.
I was happy, I was excited. It was a really overwhelming feeling to hold her for the first time. It was the first time I ever held a baby.
Brianna weighs in at a healthy 8 pounds and 12 ounces. David and Katie are overjoyed. But almost as soon as they take their newborn home, something doesn't seem right.
Feeding her was very difficult. She always seemed to eat maybe 1.5 ounces, and then within 5 minutes, she would just throw up everywhere.
You'd need a bath towel. You couldn't use a burp rag. It was a huge mess.
Everyone told me baby spit up, but to me, this was throwing up. The vomit was projectile. It would shoot out so hard and so much. I called her the exorcist baby. I was worried that she wasn't gaining weight and keeping all the vitamins that she needed from the milk down. Her behavior didn't seem normal, so we took her to see a doctor.
After performing a thorough exam, the pediatrician assures Katie that there's nothing wrong with their 2-week-old's weight. She's simply suffering from acid reflux, a common disorder in infants. Babies with acid reflux regurgitate their stomach contents because their digestive systems are immature.
The doctor said it was normal for Bree to have acid reflux and it would cause her to throw up every time she ate. He said her stomach might just be sensitive and suggested switching to a new formula.
We tried a few different formulas.
Nothing changed. The vomit didn't get worse, it was just steady. It was the same.
And difficult as it is to cope with the incessant vomiting, things get even tougher when Brianna develops an alarming new symptom.
Brianna would cry so loud I thought our neighbors would call the cops on us.
We could hear it throughout the house. It was just this piercing cry.
If she wasn't crying, she looked dazed. She never acted like a normal baby. And I went back to the doctor and I said, this is not working. We need to try something else.
But again, the doctor can find nothing wrong with Brianna. He's confident that she merely has a classic case of colic.
The doctor explained to us that colicky babies tend to cry a lot, they spit up a lot, it will pass after a couple months. I did not want to go back to the house and just listen to her cry and cry and cry. I did not think it was common, but that's what we were told.
Despite their misgivings, Katie and David do their best to put their worries behind them and concentrate on caring for their daughter. Then, one seemingly ordinary morning in late September, they get the shock of their lives.
We went to change Bree one time and she threw her arms back. She locked up for a couple seconds. She was hard as a rock, almost like you could drop her and she'd break like glass.
I couldn't move her. We were scared to death.
Her eyes bounced all the way in the back of her head. She looked like a deer that had just got shot, and I knew that was not normal. I had no idea what was going on. I knew something was not right.
Since David and Katie Headings brought their newborn Brianna home from the hospital, she's been vomiting and crying constantly. Her doctor is sure it's a harmless case of colic and acid reflux. But now, without warning, the 5-week-old's whole body has gone completely rigid, and her eyes are wildly rolling around in their sockets.
We rushed to the ER. We had no idea what was going on with Bree.
And the nurse says she's having a seizure. And they gave her the anti-seizure medication.
As soon as the medical team stabilizes Brianna, they admit her to the hospital for tests.
They decided to run an EEG to see what her brain activity was doing.
The EEG confirms that Brianna is having seizures, but the doctors are unable to pinpoint what's triggering them.
The doctor believed that she could be epileptic.
Epilepsy is a neurological disorder in which individuals experience repeated seizures. Attacks can be sparked by illness, cerebral injury, brain abnormalities, or have no known cause at all.
The doctors told us that an epileptic might have a seizure here and there, and she was prescribed the anti-seizure medication. I never believed she had epilepsy. I never believed it. She threw up too much that I did not believe that that was the reason why.
Frustrated but anxious to help their daughter, the Headings faithfully administer the medication. But over the next 2 months, Brianna only gets worse, and the young couple starts to feel like they're living in a nightmare.
She was still having seizures, still getting worse, still throwing up. She just looked like she was giving up. We went to the ER at least every weekend.
The doctors just increased the medication and told us to keep doing what we were doing.
Every time she had a seizure, I thought that it was affecting her brain and it's going to affect her for the rest of her life.
These first couple months were so rough on us. We were so stressed out. We were physically and mentally exhausted.
But nothing could have prepared them for what happens next.
David and I were sitting on the bed, and he couldn't get her to sleep, so he passed her over to me, and she curled up and locked up, and that was it. She stopped moving. She stopped breathing.
I immediately started giving her CPR.
And I went blank. I could not do anything.
I had to tell her what the number for 911 was. Just a few minutes later, the EMS was there.
We were rushed to the ER, and they wanted to get an IV in. They wanted to get her vitals, monitor her heartbeat, monitor anything that was going on.
Then, suddenly, Brianna plunges into a full-blown seizure.
Her eyes started to bounce in the back of her head, and her body would make like a twitching movement. She would make this noise like she was getting shocked by electricity. It was really hard to watch that. I was really worried I would lose Bri. Really worried.
Nobody seemed like they were doing anything to stop the seizures. A nurse would come by and say a doctor would be by. Nobody ever came. I was furious with the help we were getting. It took everything I had not to lose control.
I would say it lasted anywhere from 6 to 9 hours.
They finally got her seizure to stop by putting an IV directly into her heart.
They just pumped it full of anti-seizure medication.
I thought I was sitting there watching my daughter drift away.
The doctor finally came in and he told us, I believe she has infantile spasms.
Infantile spasms is a type of epilepsy in which a cluster of quick body jerks is followed by stiffening.
The doctor decided that he wanted to put her on a steroid to help with the seizures. I was scared that he wanted to put her on a steroid because she was such a little baby. I believed that we needed to find someone else so we could start over. I wanted new answers, new doctors. I wanted everything to be new, start fresh.
We wanted to get a second opinion.
Determined to get some answers, Katie and David decide to leave immediately for Children's Mercy, a well-regarded hospital 200 miles away.
I was like, we need to go. I will take her myself. And they told me I could not drive her because she was too sick to drive. Children's Mercy sent a helicopter to get Bri.
I ran out to the car and drove to Kansas City, and the whole time I just kept thinking that my daughter's gonna die, and I couldn't get there fast enough.
It's hard to sit there and watch someone you carry for 9 months go through that.
I felt like my life was over. I was completely drained physically and mentally. I thought by the time I made it to Kansas City that I'd be preparing for a funeral.
For 6 agonizing hours, David and Katie Headings have watched their infant daughter endure harrowing seizures that her medical team can't seem to stop. Now, Katie and 10-week-old Brianna are being airlifted to Children's Mercy Hospital in Kansas City for a second opinion.
I thought Bri was dying. She just looked like she was giving up.
Katie is met in the emergency room by Dr. Robert Cruz, a pediatric neurologist.
Her vital signs were stable, but as we stood at the bedside and watched her, we could see her have seizures. So we arranged to have her admitted to the epilepsy monitoring unit.
He wanted to see what her brain activity was doing.
We looked at the EEG and saw that the pattern was not infantile spasms. That's when we decided we had to be thinking about other things.
Dr. Cruz suspects he might know what's behind Brianna's seizures. To confirm his theory, he gives her a high dose of vitamin B6 while monitoring her brainwaves on the EEG.
We gave 100 milligrams intravenously during the EEG monitoring. We knew if we gave the medication that it would work very quickly within minutes and that we could be fairly confident what the diagnosis was.
We were really hopeful that this was going to be the answer to her prayers.
We gave the medication and we watched the EEG, and we could see the abnormal electrical activity almost go away completely. She stopped having seizures almost immediately.
Brianna's dramatic response to the vitamin B6 confirms Dr. Cruz's theory.
Brianna was diagnosed to have pyridoxine-dependent seizures.
Pyridoxine-dependent seizures is a very rare genetic condition that prevents the body from breaking down pyridoxine, or vitamin B6. In a healthy individual, the body converts vitamin B6 into neurotransmitters, which help brain cells send signals to the body. But patients like Brianna can't process enough B6 to keep the brain running smoothly. As a result, muscles receive mixed messages, which ultimately leads to seizures.
Vitamin B6 is a factor that the brain uses to make neurotransmitters, and that's how the brain cells communicate. She can't utilize the vitamin B6, so the brain cells can't send messages to other parts of the body, to move an arm, to move a leg. I don't think anyone really understands why certain parts of the brain have abnormal surges of electrical activity or a seizure at a given time.
I didn't believe Dr. Cruz. I didn't believe that after everything we went through, he's telling me it's a vitamin deficiency.
Your parents thought I was a little bit wacko or something, you know. What's he talking about, a vitamin, some sort of quack?
But as the doctor explains it, Katie and David can see that all of Brianna's symptoms were a direct result of her B6 disorder, starting with the throwing up.
I think children with pyridoxine deficiency have a much, much greater incidence of reflux than healthy children. The brain isn't functioning normally, and so you vomit as part of an instability of the nervous system.
As for the anti-seizure medications Brianna took, even when they worked, it wasn't for long because they never targeted her real problem.
The IV medicines that Brianna received initially have an effect on stabilizing brain cells regardless of the cause. And then gradually they seem to be less effective. Those medicines are sort of stabilizing certain parts of the brain cell, but the parts they're stabilizing isn't the culprit of the problem.
And as long as she went without vitamin B6, Brianna's condition only got worse.
The more abnormal the cells are functioning, and the more they have a tendency to have seizures.
As the Headings begin to understand the true nature of their daughter's disease, one thing is crystal clear. Brianna was diagnosed in the nick of time.
If her seizures wouldn't have been controlled, she would have been a child who pretty much was bedfast, not walking, not talking, and totally dependent upon adults for her care.
I believe that she would have died pretty soon if we didn't get a diagnosis.
Unfortunately, there is no cure for pyridoxine deficiency, but it can be managed. Dr. Cruz will prescribe Brianna huge daily doses of vitamin B6, increasing the amounts as she gets older.
We're not exactly sure how supplementing vitamin B6 works. We presume that if we give extra amounts of the B6, it cranks up the system to work more efficiently.
Remarkably, within a week, all of Brianna's symptoms disappear.
I can't believe that one vitamin would stop everything that she was going through.
Unfortunately, while Brianna's condition is now under control, she may have suffered permanent damage to her brain.
Children with this condition, the most significant negative effect is on language and communication. And she's too young to judge that right now, so we'll have to wait and see.
We are not sure what the lasting effects from having the seizures for 4 months are. They do compare her to kids her age, and that she should be doing this or she should be doing that by now, but I also have to remember what she went through.
Though David and Katie are confident that Brianna will make up lost ground, they can't help but wonder why she had to suffer through weeks of seizures before being diagnosed correctly.
It's my understanding as of 1999, there was about 100 cases reported in the literature.
Since it is so rare, I do understand a little bit that it took a little while to get a diagnosis, but I still believe that doctors should have put the signs together and been able to figure it out.
Today, Brianna is almost 2 years old, and she's starting to meet all her milestones.
I think her prognosis for seizure control is very good. And I think her development is also guardedly optimistic.
I believe that we caught it really early, so she has a good chance to grow up and not have any problems.
In Iraq, I've been shot at, blown up, I've been mortared, rocketed, you name it, and it doesn't even come close to as scared as I was going through what we did with Bri.
She wasn't ready to give up, and I think that that's how she's going to be for the rest of her life.
I love to be able to spend all day with her now. I get to see all these new things that she's doing. I'm glad I'm not missing it.